We are honored to have with us today a very talented and distinguished leader in pharmacy and an advocate for public health. Linda Evans Parlette represented Washington's 12th Legislative District from 1997 to 2016. She truly is the health lady. She attended Washington State University and graduated with honors from the WSU Pharmacy program in 1968. During her time in the Senate, Linda's main focus were the healthcare, natural resources, and ways and means committees. Her experience as a pharmacist was her foundation for her work on healthcare issues. Please join me in welcoming Linda Evans Parlette.
Dean Parlette, members of the faculty, graduates and your family, and ladies and gentlemen, I am delighted to be here today, not just because I'm a fellow Cougar, and not just because I'm a fellow pharmacy graduate, but as you heard, because it has been 50 years since I was seated where you are today. 50 years, my goodness. If you had told me back then, in June of 1968, that I would be here in May of 2018, I never would have believed it. There was a lot of turmoil in those days, and no one my age was thinking a half century ahead. I was in the middle of preparing my remarks for today when Barbara Bush, the beloved former First Lady of our country, passed away. Some of the news coverage about her life made reference to a speech she had made at Wellesley's College in 1990. I looked up her speech, and then I understood why it is so well remembered. She spoke of making choices, about big ideas, and seeking the joy in life, and cherishing the human connections we make. If you get the opportunity, read the speech yourself, and you'll notice one of the things that I did, how Mrs. Bush, who was First Lady from 1989 to 1993, spoke of how 1990 was part of the transitional period. She was correct. But I have to tell you, I believe we were also in a transitional period in 1968 when I graduated. I started WSU in the same year that Dr. Martin Luther King Jr. delivered his famous speech known as "I Have a Dream" during a march on Washington, D.C. It was also the year that President John F. Kennedy was assassinated in Dallas. During my fifth and final year, about a month before I graduated, Dr. King was assassinated in Memphis. And not long after that, Senator Robert Kennedy was assassinated while campaigning in Los Angeles for the Democrat presidential nomination. The only thing I remember during my graduation time, so don't feel bad if you didn't remember his first speech, the only thing I remember was that the flag was flown at half-mast in Senator Kennedy's memory. There was a civil rights movement which hit full stride while I was in college. The Vietnam War had escalated significantly by 1968. It was the dominant issue in that year's presidential election. Even though our access to news and opinion was very limited compared to today, we had an awareness of the turmoil, of the polarized feelings that were on our campus, in our community, and most of all, in our nation. There was unrest and distrust. It was most definitely a transitional period. I believe we're in a transitional period now, just as much as the class of 1990 was, or my class was. And I think most of that is being driven by technology. Think about social media, which started off as a new way to communicate. Now it's become the subject of congressional hearings, and people are wondering how much they can trust in what they read, and in what they see. We don't just have online shopping. We now have a new form of crime related to online shopping, and new products and services that are meant to prevent those crimes. There is still unrest in the world. There are still unpopular military actions. And let's hope that we will not see senseless political assassinations, but we are continuing to see senseless mass shootings. An ancient Greek philosopher is credited with observing that change is the only constant in life. And in that sense, I will suggest that we are constantly in a transitional period. And in that case, I think the advice from Barbara Bush's speech in 1990 is just as useful today as it was then. In fact, it will always be good advice. But let's talk about pharmacy. I would love to know what brought you to Washington State University and the College of Pharmacy, and ultimately to this joyous occasion today. I did not grow up wanting to be a pharmacist, and the path that led me to pharmacy school was a little unusual. I was raised on 15 acres of apples. Our whole livelihood depended upon the weather. It was a bit unnerving when the hail clouds would travel over our apple orchard. One bad hailstorm would totally wipe out a crop of apples, and the household budget along with it. Although my parents didn't go to college, I always knew that I wanted to go to college someday. And I knew my degree would be an insurance policy, so I could find a job and support myself no matter where I lived, no matter what the weather. My plan throughout junior high and high school was to be a teacher. I was going to study math and science and minor in physical education. And then during my senior year at Chelan High School, the superintendent of the Lake Chelan School District stopped me in the hallway. It was late in my senior year because I already knew that I was the class valedictorian. And he asked me, knowing your skills in math and science, have you ever considered a career in the healthcare field? Those few minutes changed my life. I quickly applied to the WSU College of Pharmacy and I was accepted. And I will always remember being dropped off by my parents in September of 1963 at the Strike Parent Dormitory. I had never set foot on the WSU campus before that day. Prior to college graduation, I remember needing to choose between retail pharmacy, hospital pharmacy, or advocacy work with the American Pharmacy Association. I had 7 different job offers. I remember APHA reaching out to me, but I had no interest in going back east. I chose retail pharmacy so I could interact with the public and also return to North Central Washington where I grew up. That meant taking the lowest paying job, but it was a but it was a lifestyle decision. I wanted the 4 seasons, the outdoor recreation, a good place to raise a family, and to be close to my roots. My earlier years as a pharmacist were so different than they are today. There were no computers, no robots that dispensed pills. Everything was done by hand, like filling out every single Medicaid prescription by hand, in triplicate, thanks to carbon paper. As you can imagine, the arrival of computers was life-changing. The list of choices you have as pharmacists have certainly expanded in the last 50 years. When I was a student, the idea of specializing was rare. I suspect most people have no idea how much more a pharmacist can do besides count pills. Our job continues in educating others. You have the option to apply for a general residency or a specialty residency, which could include ambulatory care, cardiology, geriatric, internal medicine, pain management, and palliative care, pediatric care, psychiatric care, the list goes on and on. Your class is part of a new wave in our profession. The pharmacists of today will be known as part of the patient management team, and not just in hospital or retail settings, The stage for this transformation was set by a piece of legislation called Senate Bill 5557. And I was the prime sponsor of this bill, which was passed by a legislature during the 2015 session and signed into law almost exactly 3 years ago. Washington State was the first in the nation with this new policy. This new law anticipated how the whole healthcare field is moving to a team-based approach, a place where professionals can work at the highest level of their scope of practice and get reimbursed for it. It allows for pharmacists to be properly reimbursed by insurance companies. It was groundbreaking in terms of what pharmacists will be able to do for patients under their covered insurance benefits. Clinics and hospitals will be able to utilize pharmacists in direct patient care to improve patient outcome. I'm as excited today as I was in 2015 that you graduates get to be part of the medical network. Finally, you are being recognized as part of a team in Washington State, so let's hope the federal government gets caught up soon. I'm also thrilled that your education here and for the future of those who follow behind you, that this campus is prepared for doctors, nurses, and pharmacists, all being educated in an interactive environment. I could not have imagined that in 1968. But I did not come here just to tell you about what an exciting time this is to be a new pharmacist graduate. After all, a commencement speech is supposed to offer perspective and words of wisdom to new graduates. So let me share a few things that I've picked up over the 50 years since I was where you are. Some are from being a mom, and some are from being a mentor to others. So number one, be the CEO of your own life. That may mean putting on blinders at times, like a horse in the Kentucky Derby. Why? So you can stay focused and don't get distracted by things off on the side. At the same time, don't leave those blinders on constantly. Don't miss out on the big picture that you are part of. Be sensitive to your surroundings. Try hard to balance work life and family. Remember the late Barbara Bush's words, take time to have fun, to find joy. Feel lucky if and when you can be passionate. I love being a mom. I also love being a grandmother. And I love the fact that after 50 years, I'm still working in the healthcare field as the Executive Director of the North Central Accountable Community of Health. I am able to witness the transformation of a variety of system changes. Number two, be open to change. Remember what the ancient Greek philosopher said about change being the only constant in life. Be open to new challenges and opportunities. My plan 50 years ago was pretty straightforward. Work as a pharmacist for the small independent drugstores, and yes, there were many of them in 1968. Get married, have children, and I had 2 sons, and it all worked out for a while. What I didn't plan on was that my first marriage would end, or that I would remarry in 1986, and I would suddenly have a blended family of 5 children. And I didn't expect, while trying to be super mom, would leave me after 6 months of a new marriage with walking pneumonia. It was never my plan to be a part of the state legislature. I have never taken a political science class in my life. But there I was in 1996, after encouragement from others, running for a seat in the House of Representatives. And I can tell you, my 20 years in the legislature were extremely fulfilling. I was proud to serve my neighbors in North Central Washington, and healthcare is such a major branch of public policy. I believe the legislature benefited from having a pharmacist among its members. And then 2 years ago, it was time for a change. I wanted more time with my husband and granddaughters, and my mother, who will be 92 in June, born the same year as Barbara Bush. So in April of 2016, I announced that I had chosen not to run for re-election. Any future public service would have to be closer to home. The changes didn't end there. I had no way of knowing that my husband, 31 years, would pass away less than a year after I completed my 60th year in the Senate. This was due to acute myeloid leukemia, most likely related to Agent Orange exposure while serving in the United States Air Force. Naturally, I am still adjusting day by day. Number 3, try not to burn bridges. I started working as a waitress before my senior year of Chelan High School. I worked in the summers to earn money for school. I learned the importance of good customer service and how ignoring personalities is so helpful. That experience served me well in the legislature. This can also apply to your personal life. The end of a marriage can bring a pain that doesn't go away. But if you don't burn bridges, it's possible to rebuild friendships with a former spouse that can be hugely important to your children. Number 4, have courage. At times it's good and appropriate to do what my former WSU lab partner, Jim Miller, said, and that's to rock the boat. Speak up when something needs to be said. Be polite, but have a backbone. In 1936, early in her time as First Lady, Eleanor Roosevelt said, "Every woman in public life needs to develop skin as tough as rhinoceros hide." Sometimes you need that as a pharmacist too. And don't bite the bait. My second husband was a trial attorney. I was a pharmacist. My job didn't involve putting people on a witness stand and grilling them. His did. Winning wasn't important to me, but winning had to be important to him. It was his job. Once that was pointed out to me during some joint counseling, there were fewer bumps in our relationship. So there is a time to bite your tongue, or as my mom said, just keep your mouth shut. Now, I should have listened to her free advice. Number 5, the greatest gift is good health, and be grateful for good health. As a pharmacist, you are all about helping sick people. The idea of whole person care is exciting, but sometimes our health is affected by things beyond our control, as my husband's situation proved. So we cannot take good health for granted. Number 6, and I'm almost done. Have the right attitude. The longer I live, the more I realize the impact of attitude on life. Attitude to me is more important than facts. It's more important than the past, the education, the money, than circumstances, than failure, than successes, than what other people think or say or do. It is more important than appearance, giftedness, or skill. It will make or break a company, a church, and a home. The remarkable thing is, we have a choice every day regarding the attitude we will embrace for that day. We cannot change our past. We cannot change the fact that people will act in a certain way. We cannot change the inevitable. The only thing we can do is play on the one string we have, and that is our attitude. I am convinced that life is 10% what happens to me and 90% of how I react to it. And so it is with you. We are in charge of our attitudes. These words were written by a pastor, Charles Swindoll, and they've been attached by a magnet to my refrigerator for almost 40 years. Number 7, and my final advice, is keep a song in your heart. She passed away. My mother and I spend most weekends either in her house or in my house in Wenatchee. She lives in Chelan still, where I grew up. One of the old TV shows that some of the old-timers here might remember was one of her favorites, Laura's Welk. And he always ended with the phrase, keep a song in your heart. That can certainly help you get through the bumpy times that are inevitable in all of our lives. So let me close with this. You have completed one of the most rigorous courses of study there is. You will leave here today with skills and knowledge that can benefit human mankind anywhere in the world. You have talents that will be prized by communities and healthcare facilities. You are prepared to serve as a medical professional, as part of a team that works to protect and restore and improve the health of your patients. I want you to really be proud of what you've accomplished. I'm also mindful of the fact that you're ending one journey today, only to start a new one. I'm inspired about all the opportunities that the future holds for each and every one of you. Thank you for the opportunity to share this very special day. Charge on and go Cougs!